Many men go years without realizing that a small, everyday discomfort can be the first warning sign that the prostate is enlarging. This growth usually starts in a discreet, almost imperceptible way, and that's exactly why so many men miss the ideal moment to act. The problem is that when it's ignored, it progresses quickly and starts to affect sleep, daily routine, and even sex life. What few people know is that the signs appear long before any stronger pain. And today, you're going to discover exactly what these signs are and why they should never be ignored. Stay with me, because what I'm about to reveal can completely change the way you see your male health. The question you need to ask yourself now is simple. Could you already be having symptoms and not realize it yet? Many of my patients only identify the problem when their life is already being visibly affected. But understanding the first sign is what separates a simple treatment from a problem that could have been avoided. And to show you this clearly, in the next section, I'm going to go straight to the point and explain what it really means to have an enlarged prostate. That way, you'll be able to see yourself in these situations and understand whether you're in the risk group. Get ready, because now we're starting the most important part of this video: what it really means to have an enlarged prostate. When we talk about an enlarged prostate, we're talking about a benign growth that happens in practically all men as they get older, but that can cause very uncomfortable symptoms if it's not monitored. This growth puts pressure on the urethra and makes it harder for urine to pass through, forcing the body to work harder for something that should be simple. It's exactly this internal pressure that gives rise to signs that many men confuse with tiredness, stress, or normal aging. Understanding this mechanism is essential to recognize early when something is off. And the earlier you identify it, the simpler the treatment and the lower the risk of complications. That's why paying attention to the right signs can save you a lot of trouble in the future. Now that you know what's happening inside your body, it becomes much easier to understand why certain symptoms show up and why they appear so gradually. An enlarged prostate doesn't hurt at first, and that's exactly why most men only notice it when the symptoms are already getting in the way of basic daily activities. But you're about to understand each one of these signs, and you'll know exactly what to look for so you're not caught off guard. In the next section, I'll show you the first sign that many men ignore, assuming it's just something temporary. So stay here, because this can be decisive for your urinary health. Before we move on, if this content is making sense to you, support the channel by leaving your like and subscribing so you don't miss the upcoming videos. Sign 1. Urgency to urinate that appears out of nowhere. Urinary urgency is that moment when you suddenly feel a strong need to urinate, even if you've just gone to the bathroom not long ago. This symptom happens because the enlarged prostate starts pressing on the bladder, which begins to interpret any small amount of urine as a red alert. Many men think it's just because they drink more water that day, but when this urgency becomes frequent, it's usually one of the first signs that something is changing. It's a subtle symptom, but it becomes more and more noticeable over time, and ignoring it can allow the problem to progress without you realizing it. That's why it's important to pay attention to how often and how intensely this urgency appears. Another important point is that this sudden urge to urinate may come with mild discomfort, like a feeling of pressure in the lower abdomen. At first, it may seem like something harmless, but when it starts to interfere with appointments, trips, or even moments of rest, it's time to turn on the warning light. Many of my patients report that they began noticing this urgency mainly during moments of anxiety or stress, but in reality, the problem is physical, not emotional. In the next section, you'll learn about another sign that shows up even more clearly in everyday life. Stay with me, because identifying these signs early can make all the difference in your treatment. Sign 2. Weak and intermittent urine stream. A weak urine stream is one of the classic signs of an enlarged prostate, and it usually appears so gradually that many men only notice it when it's already very obvious. This happens because, as the prostate grows, it squeezes the urethra as if it were choking the passage of urine, reducing the force and causing interruptions in the flow. Many men see this symptom as something normal with age, but it's not quite like that. When the stream starts to lose strength, it usually means there's already a significant blockage. It's a symptom that directly affects comfort when urinating and can cause frustration in everyday life. The earlier it's identified, the easier it is to correct the problem before it progresses. Another important detail is that a weak stream may come with a slower start and finish, as if your body needs to insist to get the flow going and can't stop immediately. This isn't just inconvenient, it's a clear sign that the urethra is under constant pressure. In some cases, the flow becomes intermittent, stopping and starting several times, which indicates that the blockage is already more severe. Watching for these changes is essential to avoid bigger complications, such as urinary retention or infections. In the next section, you'll learn about a symptom that directly affects the quality of your sleep and that millions of men deal with every day without knowing the cause. Sign 3. Waking up several times at night to urinate. Waking up repeatedly during the night to urinate is one of the signs that most affects your routine because it directly impacts the quality of your sleep. This symptom, known as nocturia, appears when an enlarged prostate starts to make it harder for the bladder to empty completely. Since urine is left over after each trip to the bathroom, your body feels the need to alert you several times during the night. Many men think this happens because they drink too much water before bed, but when it becomes a frequent pattern, the cause is usually something else. It's important to notice how long this has been happening and whether the frequency is increasing over the months. The problem is that these constant interruptions to your sleep affect not only your rest, but also your daily energy, focus, and even libido. When the body doesn't sleep well, even routine activities start to require more effort than they should. Nocturia is also a sign that the bladder is working harder than normal to compensate for the blockage created by the prostate. That's why this symptom deserves attention and shouldn't be treated as something normal with age. In the next section, you'll understand a sign that often goes unnoticed, but reveals a lot about how the prostate is behaving. If this video is helping you identify important signs, support the channel by leaving your like and subscribing to follow the next content. Sign 4. The feeling of a bladder that's always full. The feeling that your bladder is always full is one of the most uncomfortable and, at the same time, most ignored signs among men. It happens because, with the enlarged prostate squeezing the urethra, the bladder can't empty completely. Even after urinating, a significant amount of urine remains, making the body interpret that there's still a need to empty. This creates that sensation of heaviness, constant pressure, or a persistent urge to go back to the bathroom just a few minutes later. It's a symptom that causes both physical and psychological discomfort because the feeling of never really being done doesn't go away. Over time, this difficulty can cause the bladder to overwork, making the muscle thicker and less efficient. Some men report that they start planning their day around nearby bathrooms, avoiding long trips or important commitments. This limitation is not normal and is a sign that something inside is making it hard for the urinary system to function naturally. Identifying this symptom early is essential to prevent more serious complications, such as urinary tract infections or complete urine retention. In the next section, I'll reveal a sign that often appears together with this one and helps complete the diagnostic picture. Stay with me, because recognizing these details can help you avoid more serious problems in the future. Sign 5. Pain or discomfort in the pelvic area. Pain or discomfort in the pelvic area usually appears when the prostate is already pressing on nearby structures, creating a feeling of heaviness, burning, or constant discomfort. This symptom can start out mild, almost imperceptible, and increase over time as the prostate grows. Many men mistake this pain for muscle tension or poor posture, but when it lasts for days or weeks, it can be an important warning sign. It's a sign that deserves attention because it shows the body is reacting to the extra effort needed to urinate or to the buildup of urine in the bladder. On top of that, this discomfort can radiate to the lower back, groin, or testicles, which makes the diagnosis even more confusing for those who don't know the symptoms of an enlarged prostate. In some cases, the pain appears only while urinating or right after, reinforcing that the source is in the urinary system. Paying attention to how often it happens, how intense it is, and in what situations it appears can help a lot in your evaluation. In the next section, you'll understand how to tell the difference between symptoms that are just age-related and those that represent a real problem, so you don't confuse things and ignore important warnings. Stay here, because we're now getting into a crucial part of the video. How to tell the difference when it's just aging and when it's a real problem. Many men believe that any difficulty urinating is simply part of getting older, but that's a half-truth that can delay important diagnoses. Yes, as the years pass, the body naturally goes through changes, but those changes shouldn't disrupt your routine or cause constant discomfort. When symptoms begin to happen more often, intensity increases, or you start changing your habits because of them, we're no longer just talking about aging. We're talking about signs that the prostate may be growing beyond what's expected. Understanding this difference is crucial to prevent simple issues from turning into complicated ones. Another key point is that isolated symptoms may seem normal, but when several appear at the same time, the chance that it's more than aging is much higher. Nocturia, for example, might happen once in a while, but when it becomes a routine, it's a warning. A weak stream shouldn't be ignored, nor should the feeling of a full bladder. The truth is that the body sends clear signals, but most men prefer to endure in silence. In the next section, you'll understand the real risks of ignoring these signs and what can happen in the long run. Before that, if this content is helping you see your health more clearly, leave your like and subscribe to strengthen the channel and not miss the next videos. The risks of ignoring the signs and what can happen in the long term. Ignoring the signs of an enlarged prostate can turn a simple problem into something serious and even dangerous. When the prostate keeps growing without proper follow-up, urinary obstruction tends to get worse, leading to episodes of complete urine retention that require immediate medical care. On top of that, the bladder is forced to work too hard for too long, which can make it weak and unable to empty properly. This constant strain increases the risk of frequent urinary infections and even stone formation. What started out as a small discomfort can evolve into complications that completely affect your quality of life. Another important risk is kidney damage. When urine can't flow properly and starts backing up toward the kidneys, internal pressure rises, which can cause inflammation and progressive loss of kidney function. This problem often goes unnoticed until it reaches more advanced stages. Also, sexual health can be affected because pelvic discomfort and urinary changes directly interfere with performance and confidence. Recognizing the signs and acting early is the best way to avoid these scenarios. In the next section, you'll discover the modern treatments that really work and how they can completely change this picture. Modern treatments, what really works today. Today, treatments for an enlarged prostate have advanced a lot and offer effective solutions for different levels of severity. For milder cases, lifestyle changes and medications that relax the prostate muscles can already bring significant relief. These drugs reduce pressure on the urethra and improve urinary flow quickly. In other cases, medications that shrink the prostate are prescribed to gradually reduce the obstruction. The important thing is that there are safe and well-tolerated options, allowing each man to find the ideal treatment for his situation. When the problem is more advanced, there are minimally invasive procedures that offer excellent results without the need for major surgery. Techniques such as vaporization, endoscopic resection, and even laser treatments can reduce prostate size with very fast recovery. In more specific cases, there are also treatments that use thermal steam or implants that open the urinary channel, restoring normal flow. The good news is that advances in urology make it possible to treat the problem with long-lasting results and a high level of safety. In the next section, you'll discover everyday habits that quietly speed up prostate growth and make all the symptoms worse. Habits that speed up prostate enlargement without you realizing it. Some daily habits can speed up prostate enlargement without you having any idea of the impact they're causing. A sedentary lifestyle, for example, reduces blood circulation in the pelvic area, promoting inflammation and worsening urinary symptoms. Likewise, frequent alcohol and caffeine intake irritates the bladder and increases the need to urinate, making your symptoms feel even more intense. Even holding your urine for too long, something very common in a busy routine, can put extra stress on the bladder and make it even harder to empty. Small daily actions have a cumulative effect that's much greater than most men imagine. Another often ignored factor is excess weight. Abdominal fat increases pressure on the bladder and prostate, worsening urinary obstruction. In addition, diets high in processed foods and low in nutrients inflame the body and create a perfect environment for prostate enlargement to progress. On the other hand, adjusting your diet, reducing irritants, and adding moderate physical activity can completely change the situation. In the next section, you'll see how to bring all this information together in a simple step to protect your male health for many years. If this content is clarifying important points for you, support the channel by leaving your like and subscribing so you keep receiving videos that truly change your health. The definitive step to protect your male health. Now that you understand each sign, you can see that an enlarged prostate doesn't appear out of nowhere. It sends clear clues along the way. The big mistake is to normalize these symptoms and assume they're just a natural part of aging. When you pay attention to your body and spot these signs early, you have a much better chance of treating the issue in a simple way, without pain, without complications, and with long-lasting results. Information is your greatest ally, and just by getting this far, you're already one step ahead of most men who ignore these warnings. The most important thing is to take control of your own health. Seeking medical follow-up, adjusting your habits, and understanding the changes in your body makes all the difference in your quality of life. This video is not just for you to recognize symptoms, but for you to act before they become a bigger problem. Your urinary and sexual health depend on continuous attention, and what you do now will define how your next years will be. Keep taking care of yourself, keep seeking information, and above all, don't ignore the signs your body is sending. That's the safest way to protect your male health for a long time.